Welcome to the Bioptimizers Awesome Health Podcast. And now here's your host, Wade T. Lightheart.
What if you could double your energy naturally without caffeine or stimulants in just 3 short months? It's not only possible, you can transform every aspect of your health if you follow the 12-week blueprint we've created for you in the Awesome Health System. The Awesome Health System is a free course where you receive a daily video lesson spanning the most cutting-edge secrets for air, water, exercise, sunshine, optimizers, mindset, and education. It's something most companies would charge hundreds of dollars for, yet you get it for free when you go to bioptimizers.com. To access your course, register to download the PDF report called 3 Phases of Bioptimization, which gets you access to the report and daily access to the first lesson in the 12-week, 84-day Awesome Health course.
Good morning, good afternoon, and good evening. It's Wade T. Lightheart with the Awesome Health Podcast, and I am excited, delighted. We're here at the BioHome with Dr. Barrett, a world-renowned, I would say, Beverly Hills plastic surgeon who just worked on me 13 days ago, and we're going to get into that in a minute. But he specializes in aesthetic and reconstructive surgery of the face, nose, and body. His passion is providing natural results with minimal downtime, utilizing holistic approaches. He has developed detailed scar management protocols and closure techniques to reduce the appearance of scars for his patients. And what's really unique is you're kind of like at the crossroads. I'm going to just put this away.
Yeah.
You're kind of at the crossroads of where biohacking side of things, these people trying to, accelerate healing and recovery and, reduce anti-aging from an internal side with an external kind of aesthetic look, that you're kind of combining those two things. And it's really unique. And it's one of the reasons that I chose you as a surgeon. How did you get there?
It's kind of interesting. I went through I went through a good standard medical school, Western practice in medicine, where we learn all about the pharmaceutical ways to treat certain diseases, and then you go on and you pick your specialty in surgery, and you don't really learn anything about nutrition. You certainly don't learn anything about biohacking. You know what I mean? None of that stuff was around when I was in medical school. Cold therapy. Antioxidants or sauna, the benefits of sauna, none of that stuff was even published by that point when I was in medical school. And then you go on, you go to a surgical residency, and you really just taught procedural things. And what I realized is when I do surgery on people, there's a whole process that happens before and a whole process that happens after that affects the outcome of my surgeries. I typically do a lot of cosmetic surgery, some reconstructive surgeries, but what you'll notice is that someone who's prepared for surgery ahead of time with the appropriate nutrition, rest, lifestyle is going to do much better actually in surgery. I can even tell when I operate on somebody that's high inflammation, they bleed. It's very hard to stop bleeding during surgeries. If I'm doing a tummy tuck or so forth, I'm struggling. And I'm like, gosh, this is really annoying, or the higher rate of complications with infections or bleeding afterwards. And I was like, you know what, I need to kind of back up a little bit. Yes, of course, these people, they don't have heart issues. We don't do any major risky surgeries for people if they have a previous heart attack, stuff like that. But I'm just talking general overall wellness, huge difference. And then I get somebody, like yourself that comes in and it's just it's beautiful. It's just things just kind of line up perfectly. There's no real major bleeding, and you can tell the difference in surgery. And nobody really talks about that. There's nothing that's published about it. This is all just me and observational kind of studies that I'm witnessing. And so I decided, I was like, you know what? I need to take a step back. I need to kind of look at the whole process so that we can kind of optimize the whole experience for our patients. And yes, I'm passionate about, surgery and cosmetic surgery. That's kind of where my focus is. But, these other things, especially some of your products, make a huge difference, and especially after surgery, And so how did I come about that? I think I read it's a roundabout story, but I read a book called Can't Hurt Me by David Goggins. I don't know if you read that book.
Oh, yeah.
Okay.
I love David Goggins.
Yeah, and then I was like, this guy's really hardcore. And then partly, somehow there was a podcast. I'll listen to some podcasts he was on. And then Ben Greenfield popped up. And And then your name popped up. And so I just started listening to podcasts and your podcasts. And I was just like, wow, I was like, there's this whole other world. And like people were talking about fasting and the benefits of fasting. I was like, that's crazy. That makes no sense because we're never taught that in medical school. It's like, how does that make sense to deprive the body of nutrients? How is that supposed to be a good thing, you know? But we never really learn all the other stuff that goes along with why we should, like humans never evolved to eat 3 meals a day. Sometimes, you know, so sometimes it's good to go to a little feast and famine and stuff like that. So this whole world kind of opened up to me. I was like, maybe I can apply this to my patients to start, you know, getting better outcomes. And as you know, that started to turn the dial in terms of my results and patient experience, the recovery times, rapid recovery techniques, and things like that we started incorporating. You know, even, you know, like your magnesium product, like, you know, magnesium. We all know that you could talk about this product, but you know, we don't get enough of it anymore because our diet is depleted. We don't get it, you know, and so, okay, yes, there's other magnesium forms out there, but yours is great because it has all these 7 different versions that get absorbed. I mean, tell me more if I'm missing anything.
You got it.
Okay, all right, yeah. And I noticed a difference when I started taking yours, but I was just like, okay, why does someone get pain after a surgery, right? Especially, let's say a breast augmentation where we put an implant underneath a muscle. It's stretching out that muscle, and you're getting muscle spasms. Why are we getting muscle spasms? Maybe there's an acute or chronic depletion of magnesium. So we started giving our patients magnesium, and they stopped, you know, for breast augmentation, they wouldn't even need the opioid pain medication. And anytime you can kind of reduce your patient's need or pain needs for opioids, it's a great thing, right? Because opioids can cause nausea, vomiting, they delay your healing, they cause constipation, all those bad things. So a simple thing like magnesium really just gets people like, you know, feeling great, and they sleep better, you know, because it helps with sleep. And then we talked about this previously, but it also helps with bowel function as well. So those 3 things is what I found, that just a simple thing like a good quality magnesium, you know, how that makes a difference for patients.
It's so interesting because I went through surgery and will walk myself through that. And I remember we go through standard procedures, and you go to the pharmacy and they say, okay, you need a stool softener, you need an antibiotic, and you need a pain opioid component. And I'm like, no, don't need the pain thing. Yeah. No, don't need the stool softener. I'll take the antibiotics. I believe in that. You're in a surgery. Okay, I'm going to run through the course like you suggest, and then I'm going to get back on my probiotics after. Right. And I just breezed through the surgery, and I have to put a caveat in there. So a couple of years ago, my girlfriend, who's also a world champion in jiu-jitsu, she came in for surgery. She had done all her research. She's really a researcher and said, this is the guy. Right. He's biohacking. He's great. So I went to the office with her and saw how much different you were from, say, other plastic surgeons. You're also athletic on your own side. We could talk a little bit about that. So I'm like, okay, that's a guy that's talking my language outside. I don't know all this stuff in surgery. I'm trusting you with that. But you get it on the other side. And I think you're kind of where the future is. I was at the Metabolic Health Summit a few weeks ago in Santa Barbara. And it's literally the lading cutting edge research. It's hosted by Dominic D'Agostino. He's very famous, works with NASA, Special Forces, all this sort of stuff. Mm-hmm. And all of these hardcore researchers bringing research to the summit, showing how medical doctors can actually get better outcomes for their patients, better outcomes, you know, short-term, long-term, and preventative side. How many years, the question that comes up for me is, how many years did you spend to get to the position just to first be a doctor and then to be a plastic surgeon? Because surgery is a big deal, right?
Yeah. So, all right. So let's talk. So we had to do college, right? We had high school and then we get college. College is 4 years. You got to do some prerequisites to get into medical school. And then medical school is 4 years on average. I did 5 years because I did a master's in health administration as well. So I got a master's and I got an MD. And that was out of Virginia. I grew up in Virginia. And then I did an additional master's degree in physiology prior to getting into medical school. So most people don't do that, but I didn't quite have the caliber at that time coming out of my college to get straight into medical school. So I did 4 years of college, 2 years of master's, and then 5 years of MD and master's. So I have 2 master's degrees and 1 MD degree. I know, it's kind of a lot.
And then surgery, then you got to get surgery specialization.
And then you have to actually match into surgery. And plastic surgery is the most competitive. There's only 90 spots in the country for plastic and reconstructive residency. Yes, a lot of people.
There's only 90 spots in the country.
In the country, yeah. So,
wow.
So just to give you an idea, like my board scores were 2 standard deviations above average. That's how well you have to do on your boards, right?
And that's a tough group of people to work and go against.
Yeah, that's average in medical school, right? So you're already in some smart group of people. So I remember really studying hard for those board exams. So if you're thinking about going to medical school, make sure or if you're thinking about going into residency, make sure you do well on your boards. That's one thing I'll say. So then I got in plastic surgery. I came out to USC. I did 6 years in plastic and reconstruct, and I went straight through. A lot of people will take a couple extra years to do research, which is great if they're like that. I was more into the hands-on. I love doing surgery and so forth. And the county hospital is a great place to train. And a lot of people don't realize that plastic surgery, we get trained in general surgery before we kind of get into the finer elements of plastic surgery. So I was doing trauma cases. Gunshot victims get, we call them the homeboy drop-offs. They drop off 5 or 6 of the buddies who all got shot, and they all come in at the same time, and it's like a war zone. You're doing triage. I was just spend time in the burn unit. The LA County burn unit is the only major burn unit in this area. So lots of crazy experience I had in terms of, major urgent life-threatening kind of things and, reconstructive stuff, and then the finer elements of plastic surgery kind of evolved later in the training. But there was really no point. There was no point that you would actually learn about optimization, I would say, except for one field, and that was burn surgery. And they focused intently on pre-albumin levels in humans in terms of their ability to heal from burn wounds. So they will do what's a test called a pre-albumin test. I don't know if that's something you've ever heard of.
It's interesting. Yeah. It's used as a way to increase anabolism for bodybuilders.
Oh,
yeah. So you use albumin, and of course that goes way back to Vince Gironda, who figured that out back in the 40s. But then now that's one of the elements that will add for people who have difficulty increasing muscle mass.
Interesting. So that's kind of that.
So recovery. There's some recovery carryovers, I think, from performance-based athletics that can be applied also pre and post op.
Right, because like if you so here's the thing. So now fast forward, we're doing plastic surgery, and I'm doing like let's say a mommy makeover surgery where we're doing a breast lift or putting implants and doing 360 liposuction, right? And that's a huge deal. You're going and physically removing fat out of somebody's subcutaneous tissue. There's blood vessels, there's nerves involved. There's a lot of electrolyte abnormalities that happen when you do something like that, and then you can put a tummy tuck on top of that. So you got to be really careful when you do these combination surgeries. If the person's not really healthy, they don't heal so great, or they need to. Sometimes they could get admitted to the hospital if they're having hypotension and stuff like that. So you got to be careful if you're going to undergo a major surgery like that on somebody. A lot of people don't realize what's involved with that, and then the amount of nutrition that you need to heal after that is intense. I tell people you need at least 20% more calories to heal after surgery. And the worst thing, one of the things that happens after surgery is they stop eating. So, excuse me. So, and that's like the last thing you want to do is stop eating. You want to be able to get nutrition so that your body can heal. Just like if you just ran a marathon or, you did a major weightlifting session, you need nutrition right after.
You need recovery.
Yeah.
You need recovery. That's very interesting. So let's fast forward to you moved out of the traumatic care kind of zone and kind of cut your teeth in that very intense environment.
Yeah.
And then you made the transition to aesthetics. So we have 3 things that we talk about at Bioptimizers: aesthetics, performance, and health.
Nice.
And there's kind of a mixture between those 3 things. Usually most people get started in aesthetics.
Yeah.
Then, their career goes on and they're just like, they got to perform. Mm-hmm. And then you kind of focus on health. And then if you get all of those, you kind of go back through the cycle again. And so that's how we ended up together. Is like, okay, I got aesthetics down in my bodybuilding career. I got my, I worked on my performance side. Now I'm on my health side, but I had a lingering condition of, say, what's called gynecomastia, which about 1 in 10 men have that case.
Very common. I actually had it myself. I don't know if I told you that.
Yeah, you did.
Yeah.
I remember at the office. Yeah. And for those who don't know, it's how would you describe it?
Well, traditional gynecomastia is just overgrowth of glandular tissue. It could be in one breast or chest area or both. Most people are both. For myself, when I was like 16 years old, I noticed like this breast growth tissue, and I was like, oh, what the hell is this?
Me too.
Yeah, it's just like, this is super annoying. And for me, it was so obvious at a younger age. It was when I wore a t-shirt, you could see it. And especially because it was asymmetric, right? It was definitely noticeable. So I went, when I grew up, we didn't have a whole lot of money at the time. We had Kaiser, and they're like, you should maybe go see a plastic surgeon to get this removed. And we couldn't do that. So I went to a general surgeon at Kaiser. He made a big incision to kind of cut it out, left kind of like a shark bite there, because he just takes a chunk of tissue. It did the job. They left a big gnarly scar there, which at first I was kind of self-conscious about, because as a man, you're trying, sometimes you want to take your shirt off, and if like first thing you do, someone's like, oh, what's that, on your chest, it kind of makes you self-conscious, and it did for a little while. I'm kind of over it now. I don't really care, but later on in life, when I became a plastic surgeon, I was like, there's got to be a better way to do this than making like a big incision. So I even learned the way that plastic surgeons do it. And yes, we can confine it to the border of the areola, but there's still a scar there. So I actually did a lot of research and kind of implemented a technique that maybe only one other doctor was using in Texas. It's kind of a microdebridement technique, meaning we make a tiny little hole with a port on the side, and we go in and we just kind of core out the glandular tissue. Like it's basically we go in there with like a drill that just kind of drills holes in the glandular tissue enough so that it just kind of sinks down and it doesn't create a shark bite, but then gets rid of the tissue, and you don't have a big scar. So.
And if we want, we'll maybe show the surgery that he just did on me 13 days ago. Amazing!
Yeah,
right now we can,
I know.
We can look at that.
Yeah, I call him. I called him the night after. He's like, "Yeah, everything's cool. Nothing's wrong." Like most of my patients, they're like, they're like sleepy, they're like out of it, from anesthesia. But you probably had done a bunch of squats or something by that time.
I actually came home and I started moving the furniture in my living room. I think I was still coming off the anesthesia.
Yeah.
And my girlfriend's like, "Hey, you probably shouldn't be moving the furniture in the house." And I'm like, well, I just kind of feel like doing something, right?
Yeah. I know. Sometimes you feel good after it, but
I felt great.
Yeah. And you did.
No issues.
Yeah.
No narcotics.
Yeah.
Very little pain. Like the pain that I've experienced is not even commensurate with, if I train my legs really hard,
right,
and I got that torturous pain in my legs, way worse than anything I experienced in the surgery that I had with you. And for people that don't know, I've had this condition since I was 13 years old. I think I remember when it first started to come up. And when it got to a certain part of my bodybuilding career, it was detrimental because they're very particular about aesthetics and symmetry and things like that. And when you have that, it's often indicative of abuse of steroids will also accelerate it. Now, I didn't have that issue, but it was still present, which gives you the illusion that maybe he's cheating or something like that. So I wanted to get that out of the way. I'm going to do some competitions as an old guy real soon. So I waited. I was in the Canadian medical system as a former Canadian.
Yeah.
And they said, "Oh yeah, just refer it out and get this done." And I had seen a lot of guys because I was subjected to a lot of people getting plastic surgery as a bodybuilder because it's quite common and it's an aesthetically driven sport.
Right.
And most of the jobs were bad.
Yeah.
And I remember going, the technology's going to improve. The technology's going to improve. And then after I saw such great results with Adelita when she went, then I was like, oh man, this is the guy. And now I'm finally ready to do that at 50.
Right.
I waited till I was 50. So it's like, I'm slow to the game.
Well, I wish I had the operation that you had. You know what I mean? And so I'm glad you came around or you waited because, some of those scars and those things, they can cause, major disfigurement, and it's as you saw.
Yeah.
So I'm glad it worked out. And speaking of Adelita, I mean, she's also one of the people that just these magic recoverers. You know what I mean?
Correct.
Like again, I see all spectrums of people, and this is just observation. I don't do any studies on this, but like she's clearly got it figured out with like what she can do with the sauna and everything else. And she was on it, and like literally 2 or 3 days, she was like perfectly fine.
And that's what was remarkable for me, because I had seen also on the other side, I used to coach fitness competitors, a lot of them do breast implants, things like that.
Yeah.
And there was a whole laundry list of potential complications, multiple surgeries, infections, disfigurement, and she goes through this thing and it's like, done. She's recovered. I'm like, wow, this is amazing.
So there are a lot of good surgeons out there, but you definitely I try to incorporate a lot of the other stuff that goes with it, but there is some skill that comes to being meticulous in surgery, and it makes a difference, right? Like how many layers we close the incisions in, how precise are we with dissection? It's like, are we going in there bluntly for just trying to, speed up and do things on the rough, or are you really taking your time? And I always kind of like to really take my time to make sure things are like done just meticulously perfect, because I like to go home at the end of the day and really feel good about what I did. It's like, it's just the best work that I could have done every single day. And I'm passionate about that. I'm passionate about each and individual person that I get to kind of touch in their lives. And I think you want to find a surgeon that does that, because it's going to translate into higher quality work. But yes, there's also the other stuff that you want to pre-optimization and then post-surgical optimization as well. All that stuff makes a difference too. But I'll tell you about the pain thing. One thing we've learned from anesthesiologists is that if you pre-inject numbing medicine into any surgical site, it's kind of like it prevents a lot of the post-operative pain. So this is something that most surgeons should start to be doing. It's like an easy thing. Like if you get a splinter in your finger, it doesn't hurt right away. Then it starts to hurt a little bit later because of the upregulation of the pain fibers. So when you're under anesthesia, your mind's asleep, but your body still feels the surgery. So if you're going in to get a knee replacement, and if they were to numb up your knee first before they did the knee replacement, your spinal cord doesn't feel the trauma, because your spinal cord is still active during anesthesia. It's just your brain that's shut off. So if they were able to numb up the knee, or like I do, I numb up the surgical site prior to doing surgery, spinal cord doesn't feel it, your body doesn't feel it, you don't upregulate your pain fibers afterwards. And that's the key to taking a 2-week breast augmentation recovery and shortening it down to like 3 days. So
wow.
Same thing with gynecomastia too.
Wow, that's a real breakthrough then.
Yeah.
To
well, yeah, I mean, it's well known. It's like the anesthesiologists talk about it all the time. They're like, hey, this study says if you pre-inject a site with numbing medicine, post-operative pain goes way down. So that's an easy one.
I'm so curious. So you moved into the plastic surgery area, you opened a place in probably the most plastic surgery oriented place, Beverly Hills.
The harshest place.
In a very difficult environment. Like people make their living on how they look. Let's face that. Cameras are unforgiving. The Hollywood scene is unforgiving. That whole industry, and of course it influences not just with the people in the acting field, but all the people that are associated that industry. So there's a trickle down effect. You go to Beverly Hills, you can see everybody looks perfect, and you're like, what's going on here?
Right.
And you're one of the guys in there.
Yeah.
What was that like, kind of breaking into that market as a plastic surgeon, moving over from, say, the trauma side, but also bringing in these other elements that are, kind of unique to accelerating the results, both pre-op and post-op?
Yeah, I think there was a kind of phase, right? So the first phase is like survival, right? You're kind of you're just like you're the little kid on the block, new kid on the block. This guy from Virginia that's self-starting, self-funding, right? And I'm just trying to I tell you, I was moonlighting at Kaiser. I'm always grateful for Kaiser, even though they did my gynecomastia surgery way back when. But I'm very grateful. I would moonlight when I first started for at least the first 3 years of my practice. I would go to Kaiser at nighttime and moonlight in general surgery. And during the day, I'd go in and I'd see patients in my practice and work on little things like the Google ads, or work on the Yelp reviews, and work on all these little things to start, because it was all self-funded, right? And it wasn't until like 2 or 3 years later, I actually could sleep in my bed at home every single night. And I didn't realize until later how detrimental that is, really, to not really sleep at night.
You want to know the importance of sleep? Go be a surgeon.
I know. So I got really good at it, but eventually I was just like, I need my focus during work. And at that point, there was enough revenue coming in. And when you first get in, you develop a reputation, and you're not going to get A-list celebrities. Randomly, I got a couple, but it was just by working really hard, and they say if you survive the first 6 months in Beverly Hills, then you can make it. So I made it in the first 6 months, but it didn't end there. I mean, and we still work really hard, and we believe in excellence and results. But your reputation takes years to kind of develop before you start getting celebrity clientele and people like yourself. And I think what you want to try to do is be yourself and bring into your practice things that you think are important. And for me, it is that kind of holistic approach. It is natural looking results. I don't feel good at the end of the day if I go home and I make somebody look unnatural, right? Like if someone goes to the beach or the pool and someone can pick out the work that they've had done, then I feel like I've failed.
Right.
My job is to kind of make things kind of like be in harmony with the person's body, whether it's a rhinoplasty, make it match kind of the overall look that they have, versus giving somebody from, Saudi Arabia a Christy Brinkley nose. It doesn't it doesn't quite work, which there are doctors that do that. They have just, one kind of thing that they do. So that's what I feel good about. And I feel like it speaks to the people that come and see me. They want natural looking results. And then more recently, I was training I started in 2018, we had our first daughter, and my brother came out to visit me, and I was 200 pounds, and I was like feeling like crap. And back in the day, I used to do some weights and, run and stuff like that. But I was just like, I gotta get my health into shape. And the LA Marathon ran right by. And so I downloaded an app. I was like, I'm going to do this marathon next year. And so I was like, and I did it, and it felt great. And so I want to keep going. And that's when I was like, I'm going to do an Ironman triathlon. And that's when I started getting into more of the podcast in terms of like health and performance. And then I was like, you know what? Some of this stuff is actually really good for general health too, and that's where I started kind of bringing in some of that stuff as I learned more about it to my patients. It was kind of a personal fitness journey that spurred it, and then that kind of brought into my awareness of it.
One of the things that was one of actually the hooks for me is that you do have an athletic background, like you're out running marathons and doing triathlons. What was the journey like on that side of things? Because being a medical doctor I think a lot of people underestimate the demands that are made on medical doctors. Then being a surgeon is another level, because you literally, people are on anesthesia. Right. People a lot of things can go wrong in a surgery, and you got to be really, detailed, and the level of precision required is extreme. And yet here you are also on top of that. And my question is, how did you find the time to run a clinic, do surgery, and do triathlons? And how did that journey evolve? And what were some of the things you learned?
And now for a Bioptimizers fixed digestion tip. Turn cultured foods into superfoods. Raw fermented foods like sauerkraut and low sugar, live yogurt can be good for you, but rarely have enough of the right probiotic strains for therapeutic benefit. So here's a way that you can turn them into superfoods. What I do is I get some raw sauerkraut or a healthy yogurt. Ideally, it's grass-fed or coconut-based, and you can empty 3 caps of P3OM into a container and mix it up thoroughly. Leave it at room temperature for a couple of hours before putting it back into the fridge. And what's going to happen is these probiotic levels will be multiplied. In fact, it doubles every 20 minutes. And then what you're going to get is you're going to have a food with strong proteolytic activity. To learn more about P3OM and why its patented strains make it the strongest probiotic available, go to www.bioptimizers.com.
Yeah, so it was kind of a breakthrough when I started that running, right? So I was like, I remember I would do surgery. I do 8-9 hours a day for surgery, sometimes up to 10. I never really try to stretch it because that to me was like it's like an athletic performance.
It is.
You need to be focused. You need to be dexterous. It's not so much like a sprint. It's not so much like shooting hoops, but it is in some ways.
There's like a flow state or a rhythm state
total
that's
flow
in it.
state.
Right.
Yeah, like I'll get quiet during a surgery. I'm kind of specific about the music I like to have. I like to do
You got a little flyer to join us, right? He's interested in getting some augmentation.
Getting some Botox and chilling out. So definitely I'll listen to music that is kind of just beats, no lyrics, because I don't engage my mind other than my motor control and everything else. And so I'll get into flow during surgeries, and then I'll have a break, and then we'll go into the next surgery. And by the end of the day, I remember I realized I was exhausted. I'd have lower back pain. But when I started running, I all of a sudden had more energy, and I was more focused during my surgeries. I was like, oh, this is cool, right? Yes, I'm taking more time to do running, but now it's giving me more time with my capabilities at work. So, doing that training with running increased my ability, my efficiency in surgery. And I also did a couple other things. I know.
Little flies getting to me.
I also started doing some meditation as well. I did transcendental meditation. Yeah. That kind of helped me in the flow state as well. Helped me kind of stay focused, keep my mind off things. So that immediately impacted my ability to work, and then also the business side of things as well. I could be more focused and get more things done. I also have 3 kids now, and that was the other thing.
How old are your kids?
They're 4 years old, 2 years old, and 7 months now.
Oh wow! So
yeah,
relatively new,
right?
Huh?
So then I learned a lot about discipline, and I was like, once I had my first daughter, I was like, I became so much more efficient with my time. It was incredible, and so I was just like, you know what? It's like we have all this time in a day, And then I just became way more efficient with my time. I'd wake up at 4:30. I wake up at 4:30 every morning, and I get my fitness done before the kids even wake up. And guess what? That gives me energy for the rest of the day. And so it does get a little draining when I'm doing a 4-hour cycle session. Which I was going to ask you is like, where do you draw the line when it comes to performance and health and longevity, right? Because they crisscross, right? Because like if you do way too much exercise or something, isn't it bad for you?
It is.
Yeah.
Peter Attia talks about this specifically, of course, and he's one of the, he was a high level endurance cyclist and got completely bagged out from that whole thing and started looking at it. And so when you get to about the top 2.5 percentile, like in that top range, that's when the benefits start to diminish, because the cost of performance at the highest level, starts to have a deleterious effect on the body.
Yeah.
So the three areas that I share with people that you want to get to is you want to get into that top 2.5 percentile of muscle mass. That's an issue that for longevity. You want to be in the top 2.5% in your cardiovascular health. And you probably want to be in the top 2.5 range for flexibility, because that's going to increase your range of motion.
Yeah.
And then if you have those, the likelihood that you're going to be in the top 2.5% of bone density is going to be there. And those are the elements that are associated with not just living long, but having a very high quality life. We call it the biospan. It's like, I don't know if we can extend life and beyond say 120. Maybe we can, maybe we can't. And there's lots of people working on that. That's not my field.
Yeah.
I'm very confident we can extend the quality of life for the time that a person has. And we could probably offset a lot of the preventative stuff. I think it was Oshansky in the New England Journal of Medicine back in the early 2000s. It was during the Bush administration. He released a paper and said that, the disability adjusted life expectancy of America was now 60 years old, even though the life expectancy was 80.
Yeah.
And so that means you're spending a quarter of your life in some sort of compromised condition where, you're not able to do the things you want, play with the kids, be with the grandkids, have fun, maybe you're on some sort of medication. And there's a whole range of consequences there. And it doesn't even talk about the impact on how you view life, how you see life, how you experience life,
right?
Your capability to contribute to society. So if you look at the real cost, it's like probably trillions of dollars, and who knows how much in lost, happy time, which I think everybody wants to be a happy person. One of the things that also, the things that you found overall on your day-to-day schedule that have contributed to your being able to perform at the highest level, both as a family man, as a surgeon, and as an athlete. What are the things that you've picked up along the way, other than time management, obviously?
Yeah, I mean, it all started with David Goggins' book, Can't Hurt Me. I highly recommend it. He's a little bit intense, but
he's very intense.
A
little bit intense.
And I've just realized, it's like, you know what? I was like, I have no damn excuses. I don't have any damn. So I just stopped making excuses for stuff, right? And I'm just gonna wake up at 4:30. And I read a book, 5 a.m. Club. It's like, look at all the really successful people. They get so much done in that first hour of the day that most people are still sleeping. And then I would go on these runs. And I still do, where everybody's sleeping in their houses, and I'm out there getting a good run and listening to an audiobook.
How often do you run?
At least 2 to 3 times a week. And then other days I'll cycle, and then I swim as well. So I mean, I'm full on in triathlon. I have the Kona Ironman World Championship coming up in October. Yeah.
Wow, that's the biggie, right?
That's the big one.
Have you done that one before?
No, I haven't done that.
So that's like your first time at that. Like, it's not easy to even get qualified for that.
Exactly.
Right?
Yeah, it's not an easy one to even get into, and it's one of the hardest ones to do because of the heat and humidity. So just doing a marathon is one thing, and then to do a marathon at the end of a 2.4 mile swim and 112-mile bike ride, and then a marathon all in 80-degree weather, high humidity, so it's just like that's a 10 to 11 hour race depending how fast you are. So yeah, that's why I think this is going to be it for me, and then I'm going to kind of back down. But what were the top things? So I think reading, okay, trying to get as much new information, listening podcasts, just always keeping the open mind to some of these things. When you came into my office with your girlfriend and you mentioned some of your stuff, I was like, all right, let me just check this out.
That's what was so unique about what I was so impressed with. I said, hey, you know what? There's definite better outcomes if you use proteolytic enzymes like mast and some of these elements.
Yeah.
Here, why don't you try these out? And boom, you incorporate it right away.
I know, but you don't understand like the implications this has for mainstream health. Like is intense. Like this, like there's another podcast I think is Isabella Wentz who talks about. She's called the Thyroid Pharmacist. She talks about how digestive enzymes cured her Hashimoto's thyroiditis.
That's right.
And it's like a lot of people don't realize that many of these autoimmune disorders they get caused in the gut, and I get so many patients that come to me. They have thyroid. They're on Synthroid because their thyroid's burnt out, and I'm asking them, I was like, what are you doing for your thyroid? And they're like, oh, I take Synthroid. I was like, has your doctor ever asked, try to figure out why your thyroid burnt out in the first place? You know what I mean? And she's like, no. Like, how come people don't even want to ask that? It's like, why the hell did this even happen? It's because your body produced antibodies most likely against your thyroid and attacked it. And it's like, why did that happen? Well, probably because you had a leaky gut and you let all these proteins in that mimicked, proteins in your thyroid. That's probably what happened. And so, I actually had myself. Growing up in Virginia, we had eat Pop-Tarts for breakfast. Nitrites in the hot dogs. It was like horrible. Coca-Cola. Like it was.
I get it.
I don't know if you had the same thing.
I think a lot of people in North America. I was a little bit lucky that my mom had an organic garden, but that was pretty common amongst my friends and things like that. My mom was unique.
Okay.
So I got lucky.
Amazing. And so Oreo cookies and milk, processed like regular pasteurized milk from God knows what. That was what we had for dessert, and there's just I had horrible allergies coming out of Virginia. When I came to California, it got some improvement, but then even out of residency, after I got past all the sleep, I was focused on that. I still had 20 food sensitivities. I started testing that, and I was like, what the hell's wrong with that? I think we chatted about it, and you're like, you should check out IGY Max and see what that can do for you. And I was already doing the probiotics and prebiotics, and I was like, all right, let me try that. And so I started taking this. I started doing it morning and night. And then I incorporated some fasting with it. And I think December of last year, after taking this, all my food sensitivities went away except for 2, and they're only moderate,
That's amazing.
I know. So it went from 20 severe down to 2.
Biome breakthrough. Folks.
Yeah. So biome
I'm not
breakthrough.
saying it, the doctor is.
So no, yeah, exactly. So I have an advantage in that I am a doctor and I have a master's in physiology that I can actually kind of pierce through this stuff and find research, and it's all there. I was like, God, this makes so much sense. But nobody talks about this.
Well, you talked about your training.
Yeah.
It's not present in the training that you went through. How many years was your whole schooling?
It is. I don't want to get in trouble, but it's all pharmaceutical brainwashing. It's only a small piece. I do believe there's a role for some pharmaceuticals.
Of course.
But I think it's overly done. And so, but they don't talk about your gut health, your gut-brain barrier. 95. So there's a study that came out just a few months ago, about a year and a half now ago. It said that if you take a single course of antibiotics, your rate of depression goes up by 50% 6 months later, no matter what, right? And I'm like, I'm giving my patients a risk of depression by 50% if I just give them antibiotics, which I need to do because of the surgeries, right? Because I'm making, big possible thing happen for bacteria.
Yeah, I took antibiotics after my surgery as instructed, and then went right onto the probiotics.
Exactly, but I'm like, now you're getting right back on it. And I recommend the Biome Breakthrough for that because it does have the prebiotics, probiotics, and the IGY Max. And then I had another, and so a lot of people don't realize that the autoimmune stuff is coming from the gut. So whether it's psoriasis, it's attacking your skin. Whether it's ulcerative colitis or Crohn's disease, it's attacking your gut. Whether it's diabetes, it could be attacking your pancreas, or it could be attacking your cell surface markers, or it could be lupus, it's attacking your blood cells, which I was starting to get lupus antibodies, by the way. And they all went away once I healed my gut. But I had a patient who came in, and I think I told you this, she's like, Dr. Barrett, thanks for the great boobs. They're fantastic, but you cured my rheumatoid arthritis.
Yeah.
And I was just like, that's awesome. I mean, I'm just like, all right, I feel good when I give people great boobs. I mean, because I want people to feel confident about the body. Right. And that's where we get high off of it. It's kind of light and fluffy and energetic. But, the fact that I helped cure, and you, through your product, helped cure this woman's rheumatoid, or reduce her flares for the most part, to the non-existent point where she doesn't have to take these.
I'm not saying cure.
Yes. Yeah. So she doesn't have to take these ridiculous immunosuppressant medications that are just horrible for you, horrible for cancer, down the line, which we know, which are all the side effects. And she's like, this is great. You just digestive enzymes and biome breakthrough, And so it's like, God, am I an alternative doctor now? Like, what the hell? what's going on here, or my plastic surgeon. And so I don't know, I get pretty stoked about it. And I teach people about intermittent fasting, like people that are, because I get a lot of people that want to feel better about their bodies, but they need to lose weight too.
Correct. That's what's unique. It's not just about, hey, we can do the surgery and get things out, but you got to deal with the things that got you there in the first place a lot of times.
Right. And so I'm different. And yes, it takes time. And my coordinator's like, all right, here he goes again. He's going to go on a spiel about intermittent fasting and gut health and all this other stuff. But I feel better when I do that because people actually listen to me. And they're like, you know what, I've lost 20 or 30 pounds and nothing else has ever worked for me except for when I started doing, intermittent fasting and starting to, get control of my gut health and all this other stuff. People just there's no awareness of that. And yeah, maybe that's why we're getting on the podcast and we're kind of trying to preach about it, because if more people know about this, they could start doing these little basic things that can make a huge difference and get them through those roadblocks. And then of course I can come and take care of all the extra skin, because that's
what you do.
We don't have a solution for that yet.
What would you say to medical doctors, practitioners, people who have gone through a similar training that you've gone through and have heard about this stuff and are kind of concerned about it? They don't know how to interact in a clinic. And what have you done? What were some of the challenges, and maybe say what were some of the benefits that came out of it?
I get it because I'm on TikTok a lot. I got 1.9 million followers on TikTok, and it's Barrett Plastic Surgery if you want to see it. It's mostly light, funny stuff that we do. But I'll go after some people and some of these doctors that are they're drinking the Kool-Aid. That's what I tell them. It's like, you are drinking the pharmaceutical Kool-Aid. Snap out of it. And I can say that because I'm a doctor. I've been through it, and I have, I have the certifications of the crap that they're, we're brainwashed, and it's not their fault.
It's not their fault.
It's not their fault. But this is what we're taught as dogma. You go through this ritualistic process of medical school, and you're like, I have this special knowledge that the layperson or Wade Lightheart doesn't have, because they didn't get to this point to learn all this stuff, right? And you kind of think okay, this is the only way to do this, and then you're taught that all these Eastern medicine practices and all this other stuff is just quackery because there's no evidence-based papers that say this stuff works. But guess what? Now they're starting to get some evidence. There's a lot of evidence-based papers out there, but you're just not taking the time to read it because you're kind of doing a self-bias, And so you got to get out of that self-bias, cycle and open up your mind to some of these things that, hey, this might work. And just like I thought about intermittent fasting, how I thought that was total nonsense, and then I actually looked into. I was like, oh wait, there actually are some really good studies that say there's a lot of benefits to doing this in certain situations, in many situations. So,
where are the studies and information that you source out as a medical doctor that you see credible as a way of saying, hey, that's something that's solid. It's a well done research with good outcomes, and it's a well designed study that's defensible. And I can say, I can experiment with this enough to give something a try. What's the standards for a medical doctor?
So it's it does come with years of reading papers, and I do have a research background to kind of, I can look at a good study, I can look at a study that's poor. Like a good study is a double randomized controlled prospective study. Right, that's taking two groups of people, and they're both getting different interventions, and they're being followed over time. And the structure of the methodology. That's why if you look at a paper, you got to look at the methods, and it's like the least fun thing to look at. It's like, all right, how do they actually select their control group and everything else? And so I think people just kind of need to. I mean, I search on PubMed, but again, I'm probably, the problem with the internet is you Google anything, and you're like, is magnesium good for you? Yes, it is. And is magnesium bad for you? Yes, it is bad for you.
Correct.
Yeah. So it's like,
you get this variance in your.
You'll find an article that actually says exactly what you want it to do. But I think the key is like, show me the study. All right. So my advice to people is find an actual study that looked at a group of people. And then how many people were in that study? Right. Like,
what's a good amount minimum?
I mean, it's hard. It's like. There was a medication that just came out, an immune modulation medication. I think it was called it was just in the news. It cured some forms of rectal cancer, complete remission. I don't know if you've heard about that.
I've actually heard. I've seen some of the research on that, and I don't know how to determine.
I know.
Is this going to get a traction trend, or is it something that's a marketing agent coming out of the pharmaceutical industry? Right.
I think it's real, but it's very specific into the type of cancer that it actually does. But the study had 5 people, and with this particular type of rectal cancer, it was really aggressive. There really wasn't much other option, and it put it into remission where they had no evidence of it. So that was actually a study. It was only 5 people. But it's like, how are you going to get 500 people with this type of rectal cancer? You know what I mean? It's just, it's
right.
It's not, you're not going to get it. So you kind of have to look at that. But if you have something like, okay, what's the rate of depression with somebody who takes a probiotic and a prebiotic on a regular basis versus somebody who doesn't? That should be an easy study to find somewhere. You know, and you can see that.
We did that with Cognibiotics. That was how we leveraged some of our research with our lab team, showing that about 95% of your serotonin, for example, is produced by your bacteria in your gut.
Right.
So if you use an antibiotic, which kind of just strip bombs everything to make sure that you want to kill the bad guys, the good guys, whatever.
Yeah.
But post antibiotic treatment, a lot of people don't think about is I need to replenish my probiotics. Otherwise, I could run into a variety of complications.
Yes.
And I'm not here to discredit antibiotics. They've saved millions of lives, and most of us are here because of them over the last 80 years or so.
Right.
The thing is prior to and after, what can we do to enhance our microbiome? And I'm happy that we're in that conversation now on a wider scale. And medical doctors are getting into that conversation, which was not the case when I started this company 18 years ago.
Right. I can't imagine what it was like 18 years ago.
Well, and a lot of the criticisms are warranted. There's a tremendous amount of Me Too companies using, pseudoscience or very flimsy claims and white labeling hopes in a bottle.
Right.
And I would say, upwards of 90 to 95% of companies would fall under that category. Yeah. And they're usually, what will happen is people will go to the store, they'll look at they read an article on Google, or they read an article in Men's Fitness, or they read an article, whatever their source of information, Vanity Fair, who knows, that X nutrient is good for you.
Right.
Right. And they go, oh, I have that. That might be beneficial for me. They walk into their, commercial nutrition store, and there's 3 different types of products on that. One's at $100, one's at $50, one's at $20, and they go, wow, looks the same to me. I'll take the $20 one, right? Yeah. And so there is a capture component in business that captures the low-hanging fruit. In other words, they're looking to make a buck. It's based on margins. It's based on what the shareholders need to make and the dominance of shareholders. It's not about the individual person. And so when Matt, my business partner, and I started Bioptimizers, and I had worked through all levels of the nutrition industry, and there was a common trend. And this is what I find, you see this in disease treatment, and you see it also in the best nutrition companies. Usually there's a founder story, had some sort of challenge, tried to solve that challenge, went through the hero's journey in that challenge, solved that problem, and started sharing it with other people who had that journey. They became, the mentor at that point, and built a company around it to serve the needs of those people and grew. And that's exactly what we did. And almost all the companies that I advocate, because I don't just advocate my products, there's a variety of companies that I say, hey, they make great vitamin C, they make, great essential fatty acids, they do whatever. That story is across the board in all of them, because when you do decide that you're going to make a superior product that has the efficacy, the margins are not the same. You can't spend as much money on marketing, but you're hoping to get to the right people who are doing their due diligence, and then as they experience the benefits of the product, they either stay on the product or they start sharing the product, or both. And that's literally how we built our business over 18 years. And now we're kind of well respected around the world.
I feel like if you're really passionate about your work and your product, you feel better at the end of the day that you're delivering, the best product that you possibly can.
Exactly.
And that's the feeling that I got when I met you and I learned about your products. And I remember I had a person in the office who helped with a lot of products that we carried, and she's like, this magnesium that you have from Bioptimizers, there's a less expensive version that we can white label. I'm like, all right, well, let me see what it is. And I was just like, all right, it's just got mag citrate in it. I was just like, all right, that's not going to work.
Well, it might deal with the stool issue.
Yeah, I know, exactly. So I was just like, I'm not going to recommend something in my office under my name that it's not the best possible thing, and I wouldn't take it myself. What I mean? And so, so that's why we have a lot of your stuff in our office. I don't know. Is there anything else that you think would really work? Because what I have all my patients start prior to surgery. I have them start on the digestive enzymes. I tell them take 4 with every meal. at least 2 weeks prior, and then take it for the rest of your life if you want. And then the same with the Biome Breakthrough, 1 scoop in the morning, 1 scoop at night, a week before, and then 6 weeks after, however long you want to do it. And then I'd have them do the magnesium twice a day, at least once or twice a day after surgery. And I find that helps them out a lot. Is there anything else out there that you think is kind of missing in terms of in your mind, being that you've gone through surgery now, that might help with recovery that you guys could suggest?
Yeah, the P3OM, it's a proteolytic probiotic, which most probiotics aren't.
Okay.
That and I can. I
take that personally by myself.
Yeah, I hope I'm not talking out of school or my PhD researchers are going to do. We did some experimentation by using antibiotics on a variety of different bacteria cultures, and we're going to be releasing that paper in the future about what strains get wiped out and what strains are extremely resilient.
Yeah.
And what I can say is P3OM it's a next generation type of probiotic, and so it's a patented probiotic. Basically, we put it through a mutation process where it was subjected to a highly toxic environment. We ran a sine wave through it, and then you have a percentage that's left over, and then you grow those on special food medium. So different probiotics respond to different prebiotics.
Okay.
And then we'll grow and divide and create different results. And so P3M, we call it the Navy SEALs of probiotics because it is the toughest probiotic that we have found when subjected to all sorts of conditions that someone would be if they were going through surgery or going through a care of antibiotics.
Got it.
And we used it also because undigested proteins are one of the biggest contaminants that get into the bloodstream and cause all these inflammatory-based conditions. So we'll hook you up with some, and you can play around. You can play around with it with your clients and see what the outcomes are. Because that's what's really neat about what you're doing is you're actually seeing people go through a controlled trauma.
Right.
At the end of the day, surgery is a trauma and the body heals itself. Right. And its capacity to heal itself is largely determined, the health of the individual and the quality of the nutrition and the adherence to the things that will allow you to recover better. And, some of those are what you do nutrition-wise, and some of those are what we do in what we call the biohacking world.
Yeah.
And it's a lot of fun because I think we're at a breakthrough, and that's what I loved about the Metabolic Health Summit is here's hardcore researchers, people with the type of background that you have that are leveraging these type of things in the real world to produce better outcomes for their patients and just a massive amount of disciplines out there, and it's neat.
There's also another interconnection there in terms of beauty, right? So
let's talk about that.
Yeah. So it's like you see what's his name, Sinclair? I forget his name, Dr. Sinclair. David Sinclair. Yeah.
Yes.
He's in his 50s.
It looks amazing.
Yeah, he looks great.
Anti-aging guy.
Yeah, he's totally anti-aging guy, and he's taking. I think what's the name of that blood sugar medication?
Metformin.
Metformin, stuff like that I wouldn't take because I'm trying to train for a triathlon. But his focus is anti-aging. But one of the things is the things that help you prevent aging also help retain beauty and help with wrinkles and all these other things. There's a crossover there, So like just by exercising, you're delaying gene expression that happens in your fourth and fifth decade of life that contributes to certain things like temporal hollowing, frontal bone loss, maxillary retrusion. These things, they're delayed when simple thing we're just doing exercise. And I think it's I can't remember the NFR, one of the NFR pathways that is responsible for that. So there's little things of biohacking that can actually affect beauty. There's of course things we know about, like a lot of sun exposure on the face is not great, because it breaks down, collagen.
I got that one.
Yeah, I do think a little bit of sunshine is actually beneficial, and you probably agree with me on that. And there's a lot of things that you can do, but I think like if people get their inflammation in their body down, like their beauty, you'll see people their inner beauty will come through. They won't need to wear makeup as much. They won't get acne on their face. It's like it all comes from internal health and wellness, I think.
Well, that's part of the recognition system. If you look at genetic replicatability, which is what determines beauty, it's how symmetry, health, vibrancy, and all that stuff. Yeah, and that's well known in literature and evolutionary biology. And if you look at what Brett Weinstein is talking about in evolutionary biology, from, like a monarch butterfly can determine variance in symmetry by like 1/10 millionth. You think, oh, how beautiful are monarch butterflies? Well, that's because of the selection process of a monarch butterfly program, right?
I didn't even know that.
Yeah, and then if you look at what Dr. Jordan Peterson, the psychologist from Canada, somewhat controversial, I think he's great.
Yeah.
And he starts expressing these things about trait identification and these are precognitive determinants of how people respond to people. And there's a reason why so many people on Hollywood celebrities or successful people in the cosmetically dependent world, they have those symmetrical portions. And now what you're able to do at your clinic is to course correct, I guess, some of those things, and make people feel better about that and give them better outcomes. So what's that like?
Yeah, so I mean, I take a holistic approach here, because if like you're going out and you're having benders every night at the club and you're drinking a lot,
nobody does that in Hollywood, do they?
Yeah. Like it's like, and you'd be surprised when it comes in the office. Like I have people come in and smelling alcohol in the breath. I'm like, the best thing you can do for your beauty right now is get some sleep. And it's just like, you're gonna pay me $1,500 to $2,000 to put some filler in your under eye, and just like where's your priorities here? It's just like, I feel like I'm putting a Band-Aid on your lifestyle, So it's like I get people that are like that. I get people that come in that they have just wicked allergies. They don't even realize it's allergies, and they think they think they just need filler underneath their eye. I'm like, have you checked like if you have a sensitivity to dust mites? Have you put a dust mite cover on your pillow? Because they'll have it on one side of their face, and these things they haven't even popped up in their mind. People that are that never been taught that diet filled with carbs all the time is and processed foods is really inflammatory for their skin, or especially young kids with even women that come into my office that are 30 years old and they have acne. I was like, there is no reason you should be having acne in your third decade of life. You shouldn't be having it. And it's like, have you looked at what you're doing, what you're eating, all this other stuff, and they're taking on more makeup that's all comedogenic and is causing even more breakouts, and just like, we got to kind of stop this cycle, get your body healthy, get your skin healthy, and then we can kind of start doing some other corrective stuff on top of that, like microneedling, which is great, which is basically stimulating healing response, right? It's taking tiny little needles, puncturing into the skin, and you can put PRP, which is platelet-rich plasma, or even now exosomes, which is actually even cooler.
Exosomes and V cells. Yeah. My business partner, Matt, just went through surgery using V cells.
Oh, wow.
And Dr. Marcella down in Austin, Texas.
Yeah.
I had a conversation with her, and I'm the cautious one. I'm like, well, let's see what happens and see what happens.
Like injecting exosomes?
Yeah, and they were doing microneedling, and then so exosomes, they're running a laser at a certain frequency range, and that seems to activate them even more so they call them these V cells. Yeah, and so she's having extraordinary outcomes. And so he just got it done. And I don't think he minds me saying that because he put it on his Instagram account.
Okay.
And two things happened. One, he had torn his Achilles tendon, and he recovered in record time after surgery because of all these things that we advocate. And then, as well as all the biohacking stuff that we advocate as well. And then he went in and got the V cells, and he said he had a little bit of nerve numbness. They probably nicked it a little bit when he was... when he got his surgery done on the Achilles, and within 2 days that was gone. But what was striking from the beauty standpoint is he got microneedling around his eye. So he was similar to me, got all the wrinkles and all that sort of stuff coming up. And I know this guy. First, it looked like he was in a UFC fight the next day. And I said, buddy, we love the UFC. And I'm like, wow, it looks like you were in a UFC fight. And he's like, no, I got this treatment. And then literally, I think it was 4 or 5 days later, and I'm on Zoom with him all the time.
Right.
I looked at him, I'm like, dude, you look like 10 years younger.
Yeah.
And he's like, yeah, that's what all my friends are saying. Like, I couldn't believe the difference of outcomes.
Yeah, I mean, if you want to talk about an industry, it's the beauty industry getting into this regenerative medicine type of stuff, or some people are even getting stem cells, IV. I don't do that, but I found early on that, for hair restoration, right? So like some men's scalp, I'll actually transfer fat cells that have adipose-derived stem cells and watch like 50% of the hair regrow.
Wow.
Yeah, crazy stuff. But you can start to get some of that with just exosome injections. You know what I mean? You don't even have to harvest fat. So there's a lot of great regenerative stuff that's happening like that.
So, well, before we wrap things up, I want to ask you about what do you see happening in the future, say over the next 20 years with the fusion between these? Do you think that's going to come together, or is it they still going to stay separate in these camps?
So it's tough, right? Because here's the thing: is you got a governmental agency called the FDA. I don't want to really kind of raise any flags on this podcast, but it's just like, something's not FDA approved. Like, this is not FDA approved.
Correct.
And it's like, this, in my opinion, is a better treatment for a lot of things than stuff that's actually FDA approved.
Yeah.
Getting a cold shower is more effective, and the research that I've seen, or cold therapy once a day is more effective than any single antidepressant medication. There's a study that actually showed that, right? Just a single dose of cold therapy every single day is more effective than taking a single antidepressant in a day. And there's a study for that. I'm not making that up, but there is some truth to that, because if you ever take a cold shower, you feel great afterwards, as you know. So I'm optimistic, but I'm cautiously optimistic. I think it's with a lot of the media outlets that people have now, where we can kind of get this information out. The more that we get this out, whether it's on Instagram, these guerrilla tactics that we're doing, where it's not taken up into these medical societies the traditional route with that it has to be FDA approved and all this other stuff. I think we might be able to move the dial, because previously people couldn't get this information out. Like right now, I can go onto TikTok and I can look up how to treat thyroid issues, and you're going to get a bunch of different ways to treat it, including perhaps the way that's traditionally treated. So I think it's going to get better, but again, there's some main roadblocks, and our current government bureaucracy for evaluating products, I think, is heavily influenced by the big pharmaceutical players in this country. That's mostly negative. So, and I don't think that's good. So, like, when you look at, like, well, the doctor's like, well, where's the double-blind randomized control study for this? Well, it costs very expensive to get these studies done, and to get FDA approval is ridiculous. Nobody wants to do that. Like,
and you're not able to achieve a patent on a natural health product where you can on a drug.
Okay, so there's no real financial incentive to do it, right?
That's right.
There's a major roadblock for a lot of this stuff that we know that works. And the funny thing is a lot of this stuff has actually existed for, like, in previous ways of, like, herbal medicine and stuff like that, but it was just kind of in different ways, or maybe not everything, but some. And so I think as we grow and we continue to kind of disseminate information more kind of organically, I think people are going to start to figure these things out. I hope.
We had Dr. Ted Ochocoso, who's recorded as one of the top 10 IQ guys in the world. A Filipino guy, beautiful man, and he's working in Washington right now to create a parallel system of kind of traditional or holistic health medicine, and he got it implemented inside of the Philippines to work, as in parallel, the same way that our medical system works, or the government kind of dictated systems. Because in the Philippines, the economics are very different in the population, as well as the availability of healthcare facilities and stuff. And he got that implemented over there because it was a cost-effective way to produce positive outcomes for the population. And he's hoping to do the same things he's lobbying in Washington. You do some really interesting things on social media and getting the message out. Maybe you could share with us where people can reach you and where they can find you.
Yeah, absolutely. I mean, my Instagram is drdanielbarrett.com, and I actually get back to a lot of people's DMs. I have a lot of your products. If you're thinking about getting surgery, on postoprecovery.com, that's my website, and like half of it's filled with Wade's products. I did come up with a CBD. I don't think you have a CBD yet, do you?
No, not yet.
Yeah,
we're working on it.
Yeah, I did do a CBD because I found CBD.
Yep.
It really helps with postoperative pain and preoperative anxiety. But
I was taking it during the whole
did
process.
you?
Oh yeah,
okay,
absolutely.
Yeah. So a CBD is kind of a breakthrough thing, and that's another hush-hush thing, right? Like, that's a whole separate topic.
Oh, it's amazing. It's amazing, and it's not hallucinogenic or anything like that. But if it's for pain, it's amazing.
Yeah, there's some states that don't even allow it. You know what I mean?
Yeah, and that's the big issue right now. Where it's available.
Right.
California's great, so we're good that way.
I know. But yeah, their website, drdanielbarrett.com. But and then if you're into TikTok, BarrettPlasticSurgery.com. We also have a podcast called The Natural Plastic Surgeon. So that just kind of we talk about supplements, we talk about people and their journeys and what their experiences are like going through surgeries and stuff like that. If people want to know more information about surgeries, check it out.
At Bioptimizers, our mission is to fix digestion. And a cornerstone of digestion is gut flora. P3OM is our patented probiotic formula. In fact, we call it the Navy SEALs of probiotics. You see, strong proteolytic or protein digesting activity is paramount to having a healthy gut flora. And of course, P3OM provides that. The good news is, unlike weaker probiotics, P3OM survives the digestion process. What it does is it basically multiplies the good guys while protecting you against pathogens, or what some people call the bad guys. P3OM really helps to rebuild your digestion. And what that allows you to do is to maximize nutrient uptake, energy, and metabolism. To find out more of how P3OM can help you, go to www.bioptimizers.com.
Thank you for listening to the Bioptimizers Awesome Health Podcast. You can find more information at bioptimizers.com.